I'm sure you've seen the news where more than 1 million people are lost every year due to chronic hepatitis.
I want to share a very short story. A few years back, when I was in school, I had this very close friend of mine that had woke up one morning and he was stooling, vomiting. We didn't know what it was. We thought it was just diarrhea. So he took his treatment, but the guy was not getting his relief. Not until he was tested for hepatitis A and he came out positive. That was when everybody was like, oh, what is hepatitis A? We thought it's just hepatitis B. Could it be this severe? So please, because of these reasons, I want to bring this information to my wonderful family so that we can learn these things and also spread the information to our loved ones. Hi guys, this is another episode of Learn with Famzini, and I brought someone very, very important to our midst, a registered nurse.
Hello, everybody. My name is Victoria. I am a nurse, and it is such a pleasure to be with Famzini today so that we can educate it together on some issues.
Guys, do you know that there is a disease that is as deadly as HIV? Hepatitis, particularly hepatitis B. Even though there are various kinds of hepatitis. Please, Nurse Victoria, can you tell us what exactly is hepatitis?
Hello, everyone, once again. So, hepatitis is a disease of the liver, and it is just plainly, simply the inflammation of the liver. And just like she has mentioned A, B, that it might interest you to know that we also have C, D, E, X, alcoholic hepatitis, and autoimmune hepatitis.
Wow. Can you give us little information that we can go home with on different kinds of hepatitis?
Mention there are different types. I'll classify hepatitis A and hepatitis E together because their mode of transmission is through the fecal-oral means. When I say fecal-oral, I mean when an individual takes in water or food that has been contaminated with the feces of an infected person. So that's how you can be infected with either hepatitis A or hepatitis E. There are also hepatitis B and C, and their modes of transmission are similar. Those are through bodily fluids, blood, sharing of sharp objects, unprotected sex, transmitted from mother to child during the delivery process. Then it can also be gotten from breast milk. It can also be gotten from sharing sharp objects like blade, knives, not all of these personal objects that are actually sharp, like all our pedicure and manicure materials as well. Yes, sharing toothbrush, all the things that are personal to you should not. There's a reason it's called personal, right? So it shouldn't be shared with other people. Can also be gotten from poor management in hospitals. Still under sharing sharp objects, for people that are addicted to drugs, some of them don't know the implication of sharing the same needle. For example, one person uses the needle to inject the substance into their body, and the other person is like, oh, please borrow me your needle now, yeah. And then they inject themselves as well. So through this means it can be transmitted. Then those that are into tattooing and all these persons, it's best when you're doing these things. If you don't have your personal material, ensure that the ones that you want them to use for you are well sterilized. Now there is also hepatitis D. Hepatitis D is unique in the sense that it only thrives in the presence of hepatitis B.
Are you saying that for someone to contract hepatitis D, the person has to have hepatitis B first?
For hepatitis D to gain ground. Now, the virus, they're independent of each other. Do you get? But for it to gain ground in someone's body, for it to really affect the body like that, there has to be hepatitis B. So someone with hepatitis D most likely has hepatitis B.
Could this alcoholic hepatitis be the result of constant drinking of alcohol?
Yes, taking large quantity of alcohol can predispose someone to alcoholic hepatitis. It can be very dicey in the sense that there are some people that take so much alcohol and still don't have alcoholic hepatitis.
Feel free to tap on that subscribe button and join the family. We've heard the different kinds of hepatitis. For the purpose of this lecture, I said we're going to be discussing mainly on hepatitis B. So please, can you tell us what are the symptoms of hepatitis B? What symptoms do people begin to see?
For the symptoms, there are a number of them. There's fever, there's vomiting, nausea, diarrhea in some cases, there's abdominal pain, right upper, that pain would be in the right upper part of the abdomen.
Okay, because that's where the liver is located.
Exactly, so the right upper part of the abdomen. Then there's also jaundice. Jaundice is yellow discoloration of the skin, of the conjunctiva as well. So this means that when someone has, say, 3, 4 or more of these symptoms, they should actually get themselves tested.
Is it possible to have hepatitis for some time without having any symptoms?
It's very possible that someone has hepatitis B without knowing that they have hepatitis B. Some of them, for some time, it may even be asymptomatic. They may not know that such is in their body. We've had instances of people just going for very regular routine checks. They discover that they have hepatitis. Then they begin to wonder where and when they got these things from. And even health professionals as well. That is why it's important that from time to time, just to ensure that you do regular checkups, your body is still functioning properly.
And that you're safe.
Exactly, because you come in contact with people that are infected from time to time.
What is your take generally on curing or managing hepatitis B? What is the solution?
There are a number of people that have hepatitis B that are living very fine, that are getting married, having children. Do you get? So it is not a death sentence. It can be managed. There is no conclusive cure to hepatitis B, but it can be managed with medications. And these medications have to be taken throughout the lifetime, like the rest of the life of the person that's infected, or that individual, just to suppress the effects of the virus in the body. So it can be managed. They can live just fine. You can always shake somebody that has hepatitis. You can, talk to them. You can live in the same room and you people will be fine. You can hug somebody with hepatitis B and you're not contacted. Now imagine the number of people that you hug. Nobody will come and say, oh, hepatitis, don't hug me. And it doesn't, because you can actually hug them. Do you get? If it's by hugging, many people would have contracted so many diseases that they will not even know. Primary prevention should be from yourself, in the sense that all the modes of transmission that I mentioned, such as protected sex and everything, you shouldn't have multiple sexual partners. That's one. Two, if you go to the barber shop or you go to get the services of a tattoo, do they call them tattoo providers? I don't know what they are called. If you get their services, you should go with your own materials, or if you do not have them, ensure that the materials that are being used for you have been sterilized. Then there's vaccination against hepatitis B. So you can always walk up to any clinic and get vaccinated for hepatitis B and you'll be just fine. But then hepatitis B vaccine doesn't cure hepatitis B. It only prevents. So if a person has hepatitis B already, there is no problem. You just have to go to the hospital and there are medications that will be provided for you. There's some routine tests that also have to be done to check the viral load of, when I say viral load, I mean to check the extent to which the virus is active in your body.
Persons have been asking, what if by mistake you get in contact with someone's bodily fluid, either the blood or any other bodily fluid? What should you do to prevent yourself from probably getting this infection?
Well, if it's, for example, say just by contact, right? The best thing for medical practitioners, it is very wise. In fact, it is a very core practice in our field that to wash your hand as often as you can after attending to one patient before attending to the other. Whether or not you even have, if it's only one patient that you have to attend to, once you are done with one procedure, you get your hands washed. So if you probably get in contact, say the blood just splashes on your body or something, the first thing you do is to quickly wash off that part. Do you understand? You wash thoroughly. Now if you get pricked by needle or by blood, even if you don't know if the person has hepatitis or any other infectious disease like that, if you get pricked by any sharp object that has been used by someone else before, wash your hand under running water. Now you press out that particular area, you bleed out, that's how you keep pressing it out so that the blood in that area comes out. After you do that, get yourself to the hospital, so that there is something called PEP, and the full meaning of PEP is post-exposure prophylaxis. Now this doesn't mean that you already have the disease. This PEP will be given to you to lessen your chances of being infected with the virus.
If at this point you still don't understand anything about hepatitis B or any kind of hepatitis, if you have any question for Nurse Victoria or for me, please drop it in the comment section. And if you have not subscribed, please subscribe to this channel, because this is where we will constantly bring health tips to you and health information to you. And tap on the like button too, so that this video can get to as many people that need this information. So please, I'll be waiting in the comment section for your questions. We will be waiting in the comment section for your questions.
Ask the questions, guys. Nobody's going to bite you.
So thank you very much for sensitizing us, Nurse Victoria.
You are welcome.
We'll see you guys next time.